Okay, folks, well, here we go with Chapter 12 on implementation, strategies, and associated concerns. And if you remember way back to the beginning, I think it was at the end of the first chapter, we talked about the generalized planning model and the steps to that. And, first step was understanding and engaging the priority population. Second step was assessing the needs. Third was setting your goals and objectives. And the fourth was, developing or selecting your intervention strategies. And then finally, and this is where we're at right now, is implementing your interventions. So we've come a long way, and still got a little ways to go, but we're well on our way to having covered all of the course material. All right, so here are the learning objectives. I'm not going to read these to you. I'll let you take a look at those, but I've got some key terms highlighted here: logic model, implementation, management, various pieces of legislation that impact the implementation process, and so on. And then here's some key terms, just a page worth this week, but starting with accounting and going all the way through pilot testing. So be on the lookout for these as we go through the material and you do the readings. All right, so I want to start out with something called logic models. Logic models used to be presented in previous versions of this textbook back with planning models, but there really are more than just planning models. A logic model gives you usually a one-page description of your organization, what the organization brings to the project, various partners that you're going to be working with, the things that you intend to do, and finally the things that you hope to get out of it. So, it's like a roadmap. When you go to take a trip, you look at where you are currently and where you want to go, and then you kind of map out how you're going to get there. So, some of the benefits to logic models are they communicate the purpose of the program and the expected results. They describe, as I said, the actions that are supposed to lead to those desired results. They become a reference point for everyone involved in the program. And so it's, like I say, it's a one-pager, and everybody can post it, at their desk or at their cubicle, and, it helps you to visualize where you are in the process. Improves people's expertise in planning, implementation, and evaluation. And an important thing is it involves the stakeholders. So you always want to involve your stakeholders in developing your program plans, because that increases your chance of success because they're committed to it. Incorporates findings from other research and previous demonstration type projects, and then helps you identify potential obstacles to the program operation, and therefore you can address those obstacles early on. So here's kind of the general focus of a planning model, or the general components of it. You've got your inputs, what you're bringing to the process. You've got what you intend to do. So that's those two things together make up your planned work. And then, of course, you've got what you hope to get out of it: your short-term outcomes, your mid-range or mid-term outcomes, and then finally your long-term outcomes. So I want to show you an example of a logic model. This is one that we put together for the Healthcare Georgia Foundation for our Live Healthy Baldwin Childhood Obesity Prevention Project. There's a lot of words on here. I'd like to at some point minimize the words, but here we go. So again, across the top, you've got your inputs, your outputs, and your outcomes. And then inputs is the stuff that you've done before, and characteristics of your organization, qualifications of your staff, and so on. The activities that you're going to be doing, and we have 4 components, so there's actually a second page to the logic model. I'd like to get it all on one page at some point, but these are 3 of our initiatives: our physical activity in the schools project, our bicycle friendly community, and safe routes to schools. And then we have a 4th, of course, our Live Healthy and Faith initiative. Then the next column over to the right is called participation, and it's all of the partners that we are working with to make those activities happen. And then we have our short-term, intermediate, and long-range outcomes. Short terms are things that are going to happen throughout the grant period, again, with respect to our activity areas. Intermediate, they should happen by the end of the grant period, and then finally the long-term things that probably won't happen in the 3 years of the grant, but we hope would happen after the grant period ended. So feel free to take a look at this and kind of look at the details under each of those columns. And again, this is a logic model. It's sort of a roadmap for what we intend to do and how we're going to go about doing it and what we hope to see as a result of our efforts. Okay, so what is implementation? Well, implementation is just the fire part of ready, aim, fire, and it's where you've done all of your prior planning. You've again done what we said before: your needs assessment, your setting your goals and objectives, selecting your intervention strategies, and now it's time to put those things into action. So here's the phases of program implementation from your textbook. Phase 1, adoption of the program. Phase 2, identifying and prioritizing the tasks to be completed. 3 is establishing a system of management. 4 is putting those plans into action. And finally, 5 is ending or sustaining the program. And so we'll look in detail at these last steps 2 through 5 in the next few slides. All right, so identifying and prioritizing tasks. I'm sure many of you do this on a daily basis. It's called a to-do list. We can also call this logistics, but there are a number of tools that can be used to help you stay on track. A to-do list is something that many people do, and it helps them to kind of set up their day. But we have tools like key activity charts. I guess that would be most like your to-do list. You can get a little bit more sophisticated with what's called a TDTL, or Task Development Timeline. And that just looks at the tasks to be completed and the months that you have to complete them, and so you lay that out in a timeline, and I'll show you an example of that in the next slide. A little bit more sophisticated still is what's called a Gantt chart, and you can see an example of that on page 349. It's very much like a TDTL, except it includes the concept of how far along are you in terms of each of the tasks. So it's not just checking it off, but it's showing that with the help of a kind of a bar graph, whether you're 10% complete, 30% complete, 60% complete, or 70% complete on a particular task, and you track it that way. PERT chart also includes kind of a graphical representation of what it is that you want to accomplish, and each of the tasks includes 3 time estimates: an optimistic time estimate, a realistic time estimate, and finally a pessimistic time estimate. And then the last one, what's called a critical path method, it also has a graphical representation of what has to be done, but it includes critical elements. So it identifies things that, without having completed those, you can't move much further. An analogy would be building a house. And so one of the first things that you have to do is you've got to put in the foundation. If you don't put in the foundation of the house, then nothing else can really happen. And so building the foundation would be a critical task according to CPM. And again, with respect to program planning, you can do the same thing. You can identify things that without having done those, you can't get much further. Hiring staff would be a good example. If you don't have staff, really you can't go much further. All right, so here's an example of a TDTL, Task Development Timeline. So down the left-hand side, you have the tasks to be accomplished, and across the top, the letters represent the months of the year. And so, identify when you want to have accomplished each of the tasks. So you're setting aside a couple of months to do your background work and develop your program rationale, do your needs assessment in March, develop your goals and objectives in April, and so on and so forth. All right, and if you're a director of a program, like I'm the director of Live Healthy Baldwin, you have to have a management system. And management basically is controlling the financial, human, and technical resources of the organization. So management systems usually incorporate or include these three things: human resources management, really critical function; financial management, obviously that's important too; and then technical resources management, which is pretty much everything else other than human and financial. So there's a lot that goes into human resources management. My wife is the Associate Vice President for Human Resources at Mercer. She's been doing human resources and higher education for close to 30 years now. There's a lot to it, a lot more than just this simple slide here, but here's an acronym that kind of points out some of the main functions of human resource management. The acronym is PADS. P stands for planning. And so as an organization, you have to plan for your human resources. You have to determine what your needs are and the qualifications of the people that you need, and how you're going to go about getting those. And then you have to actually acquire those people. And so that means that you have to advertise for positions, and you have to take applications, and you have to screen those applicants, and you have to interview those applicants, and then you have to hire them. That's what's called onboarding. So you bring people on board, acclimate them to the organization, and bring them fully into the organization. And then you don't stop there. Once you have that, then you have to train and develop people. People don't come with all of the skills, all of the tools that they need to be able to function fully in an organization, and so you have to provide training for them. And that might be sending them to conferences, it might be having them participate in webinars, it might be a mentoring thing, but all of that goes into developing staff. The people that you hire on day one, are not going to be the same people that you have, 10, 15 years down the line. They're going to grow and they're going to develop. And then finally, I'm not crazy about this last word because it has sort of a negative connotation to it, but I would, probably substitute evaluation for that. You always want to let your employees know where they are. You have annual reviews with them, and you want to make sure that they're adhering to the expectations of you and the organization, and doing everything that's possible for the good of the organization. So the word sanction kind of means that you would correct people if they're doing things incorrectly, and might even put some procedures in place to help them improve. Again, I prefer the evaluation term, but I guess that's not as nice an acronym as PADS. Okay, so the next function of management is financial management, and basically that is just being good stewards of the money that's given to you, either from a parent organization or money that you might have gotten through grants or whatever. And so the word accounting, sort of the root of the word accountable, and so accounting is just being able to show where the money is coming in and where it's going out, and so that's something that you have to be aware of and pay attention to. The idea of a fiscal year, a fiscal year can vary depending on the organization, but for Georgia College, for example, or the state of Georgia, the fiscal year goes from July 1st of a particular year to June 30th of the next year. So, we're currently in the fiscal year, certainly approaching the 2/3 way, where we started in July 1 of 2015, and now we're going to end in June 30th of 2016. Sometimes the fiscal year will run from January 1st of, let's say 2016 to December 31st of the same year. But regardless of what system you use, you just need to be aware that a fiscal year is 12 months, and that at the end of the year you need to show where you've spent the money and be accountable for that. So that's the idea of fiscal accountability, and to make sure that people are being good stewards of the money. We do audits. Sometimes those audits can be internal, so you may have a finance person on staff who does that, but then also from time to time, again, just to make sure that everything is going well, you might hire an external person to come in and audit your books. All right, and then technical resources management, that just basically means everything else that's not human or financial. And so we think of things like communication, both internal and external, equipment and supplies, expertise, information materials, partners and relationships, and space and facilities. And so there's some pictures over here to kind of illustrate a number of those things. All right, so now we go to step 4 of the implementation process, and that's putting your plans into action. And there's a number of different ways that you can do that. And I've listed 3 things here: pilot testing or field testing, phasing in, and total implementation. And ultimately, you want to get to total implementation, but there are different ways to get there. And so we can think of it in terms of an inverted pyramid here, where on the left-hand side you have the advantages of doing it a particular way, of each of those 3 things, and then over on the right-hand side the disadvantages. And the relative width of the pyramid indicates the number of programs or components of the program and the number of participants. And so, total program implementation obviously has all of the elements of the program and all of the participants. Phased in would, and we'll look at that in more detail here in a minute, but phased in would gradually implement the program components and then, bring in more people as you go along. And then pilot testing would be the smallest number of participants. Actually you don't usually use actual participants, but you use people that would be like the priority population that would be in your program, and you basically test out your procedures to make sure that everything's working. So pilot testing, obviously the word comes from test pilots who are employed to put aircraft through their paces before we actually put passengers on there. So, new prototypes of aircraft will have people that, test the aircraft to its limits to make sure that it's safe ultimately for, putting other people on. So it's a crucial step in the process. It's used to work out the bugs before you go to phasing in or full implementation, and you should do it in a similar setting and with people that are going to be like those that are in your priority population. So you want to make sure, through pilot testing that all of the intervention activities work as planned, that the program logistics have been worked out, and it gives program planners an opportunity to evaluate the program before it's actually implemented. So phasing in is gradual implementation. It allows you to keep control over the process and not get in, over your heads. And there's different ways to phase in. Imagine if you were wanting to implement some kind of a fitness and nutrition program for all Baldwin County school-age kids. We have 4 elementary schools. We've got the Early Learning Center. We've got a big middle school, a big high school, and there's probably 3,500 to 5,000 students in the system in all of those different buildings at all of those different grade levels. And so if you had a program that was going to try to reach all of those students, imagine trying to roll that out in totality on, day one and try to keep a handle on how things were going. I think you can imagine that that would be pretty overwhelming. And so, a phased in approach where you add components or you add participants, might make the most sense. So ways to phase in by different program offerings. So maybe you start with nutrition or some aspect of the nutrition program, and then you add other components of the nutrition program, and then you go to physical activity. And by doing so, you're gradually adding complexity, but you're also adding participants as you go along, or different program components. You can gradually increase the number of participants. So you might start with pre-K and then add first grade and then second grade and so on, or you may do it by building. So we'll start with Midway Elementary School, then we'll add Blandy Hills, then we'll add Creekside, and so on. And I'm sure you can think of other ways to divide up the work or the project so that it can be gradually implemented. Total implementation only works when you have something that's of limited scope and maybe even a one-shot thing. And I can think of a health fair as an example. And there really is no way to phase that in. You just basically have to plan it and you have to do it. It might be a 1 day or a 2 day or even a 1 week kind of a thing. But basically you don't have really much option other than total implementation. So it's not recommended for really complex health promotion programs where you're dealing with a lot of people in a lot of different settings. As I said before, it would be pretty overwhelming to try to do something like that all at once. So, ultimately you want to get to total implementation. And the recommended way to do that is to do a pilot study first. And if you've got a complex program, find some way to phase it in and by whatever you feel makes the most sense. And then ultimately you reach total implementation. Okay, so when you go to roll out a program, you need to think about being, Barnum and Bailey, being a promoter. And so, think about the marketing mix. What are the 4 Ps? And what's that last word? The last word, of course, is promotion. So you've got to promote, promote, promote. So, again, what would attract people to come? What would get the media's attention? You could have a big ribbon cutting. You could have, a local celebrity or a national celebrity come in that would attract attention. You can plan things like a fun run or walk. Create a carnival atmosphere with the big inflatable kinds of things that you get people's attention and kind of scream, this is a fun activity. And then, of course, media coverage is really, really important, whether that's television, radio, newspaper. The nice thing about being in a small town is, things like this can be news, and they're willing to do stories about it. So if you've got an open streets event, for example, coming up, contact the local newspaper and tell them about it. And, maybe they'll come and do a story for you, which is really free promotion, free publicity. But you also want to keep in mind the concept of a news hook. So if they do a story, they're going to want to have something that's going to attract the reader's attention. So maybe you have a story about a family in a neighborhood who's been positively impacted by, let's say a community garden. And so you're wanting to start another community garden in another area of town, and you can bring in, the testimony of this family. And so that becomes the news hook that would attract readers to read the story. And reporters are always looking for that kind of thing, whether it's radio, whether it's newspaper or television. They want that, they're looking for the hook. All right, so here's some examples of health promotion programs for different kinds of chronic conditions, and on the right-hand side, some things that you might consider doing to kind of kick off a long-term health promotion program. Okay, so finally, what happens at the end of a program, or when does a program end? Well, obviously, if you met all of your goals and there wasn't anything else to do, then of course the program would meet its natural end. Or if you're a grant-funded program or a state-funded program, when those resources are not there anymore, and usually funding is for a specific period of time, whether it's a year or 2 years, 3 years, 4 years, whatever. Ultimately, that period of time runs out. And so at that point, then, unless new resources can be found, then the program ends. So what are some ways of sustaining a program, keeping it going? What I always say with childhood obesity, it took us a long time to get to this place. It's going to take us a long time to get out of it. Maybe even generations before we see a reversal of the childhood obesity epidemic. So always, always, always you want to advocate for your program. It's interesting when we got the additional 3 years of funding from the Healthcare Georgia Foundation, the newspaper did a story about it. It happened to be in the same edition where they'd done another story about another program in the community that was being discontinued. It had been in place for probably 5 or 6 years. It was funded by the Knight Foundation. The Knight Foundation funded them, I think, for 4 years, and then the university picked it up for a couple of years so that it wouldn't die. But ultimately, the university decided that it just wasn't going anywhere. It wasn't meeting its goals and objectives, and so the university decided that it was going to pull the plug. So here you had two programs in the community. One was being discontinued, and the other one was being continued, and those both appeared in the same edition. Interestingly enough. You can institutionalize the program. If your organization, if you feel like the work is worth continuing and you can shift some things around, shift some money around, then basically you absorb the work into your organization. You can look at the program rationale, you can revisit it, you can revise it, and you can submit it to other funders to try to find additional funding. And then also, and this is probably the way that we're going here with Live Healthy Baldwin, is our partner organizations are going to kind of carry the torch or pick up the work. So the Community Garden Association is continuing to do work around community gardens and farmers markets. The Bicycling Club in Milledgeville, it's going to be the advocacy organization that advocates for bicycle pedestrian improvements in the community. And again, if you can get partner organizations to continue the work, then basically you've sustained the program. Okay, so a little bit about keeping records. It's inevitable that you have to do reports. If you are receiving funding from an outside organization, they're going to require you to submit progress reports. We have to do a 6-month report every year. We have to do an annual report at the end of 12 months. Why? Because we're accountable to the funders. Also, it helps with public relations. So you report your successes, you report your challenges, but always you're promoting your program. It helps to keep current participants motivated. You're always kind of sharing your successes. We have quarterly partnership meetings, and at those quarterly partnership meetings, we're always telling the people that come about our progress, and that keeps people motivated to continue. And it also helps when you're recruiting new partners or recruiting new participants. All right, so when we're implementing our health promotion program interventions, we need to keep these things in mind. There are going to be legal concerns, medical concerns, safety issues, registration, fee collection, record keeping. There are some things that need to be kept under lock and key. Anytime you have information that would identify who the participants are, things like social security numbers and so on, those things need to be kept under lock and key, and they need to be kept typically for a 7-year period of time. And after that, that stuff needs to be, those records needs to be destroyed, and usually that's done through shredding, incineration, or both. Concept of anonymity and confidentiality. Anonymity is when you can't identify a particular piece of information with a participant, so it's completely anonymous. Confidentiality is when you can link the information with the participant, but then you pledge to keep that information from getting out into hands other than the absolute people that need to know. And then finally, some of the things that govern that, a piece of legislation that I'm sure you've heard about, HIPAA, which is the Health Insurance Portability and Accountability Act. It was basically put into place so that people that change jobs could carry their health insurance with them. That's the concept of portability. But there were a lot of things within that act that ensured that health information about an individual's conditions, whether they had a certain disease, diabetes, cancer, and so on, that was protected information and couldn't be held against them as they went to a new employer. All right, other concerns: program logistics, or basically our procedures for doing things, moral and ethical concerns. All of this should be documented and written down in procedural manuals or participant manuals. As people turn over in organizations, unless you have a written record of how you do things and how you're supposed to do things, then that information can get changed, it can get lost. So, a good set of policies and procedures is really, really essential for onboarding new people, for training new people, but also for making sure that programs are carried out the way you intend them to be carried out. And of course, that I already mentioned that's helpful for training. Okay, so here's a list of bad things that could happen. You can't protect yourself against everything, but you do your best to do that. If you have food at an event, there could be food poisoning, there could be choking, there could be allergic reactions to things. People can get stung by bees and have an allergic reaction. You can have injuries, facilities can be damaged or destroyed. Somebody might breach that concept of confidentiality, which makes you vulnerable or liable. You could have a transmission of infection. Interestingly, over here on the right-hand side, the third one, a fight might break out among some program participants, which unfortunately we've already seen here in the recent past. Okay, so all of this is to say that you need to protect yourself against the concept of liability. So as a program planner, you are liable if bad things happen, and so you need to manage any risks that might be out there. So people should not participate without going through the process of informed consent, and we'll see what that entails here in a little bit. But basically, you're telling them what the risks of participation are, and you're telling them what the possible benefits are, and you're telling them that they essentially are participating voluntarily and that they can cease to participate or stop participating at any time. We mentioned confidentiality, and then the last thing is really, really important, and that's the concept of negligence. So even though somebody would have signed informed consent and maybe waived their liability through a form that you had them sign, that they were participating voluntarily, they understand that they could get hurt, and they sign off on their right to sue. That doesn't do anything for you if you're found to be negligent. And so that means that if you fail to do something that you should do and somebody gets injured or hurt as a result, then regardless of whatever forms they sign, they still could sue you and be successful. So it can be things that you do, commission, that's what that's called, or things that you don't do, which are acts of omission. So an example of that is if you had kids out playing on a playground and you failed to go out and inspect the playground, and there were, let's say hypodermic needles out there, or broken glass, or rocks out there that kids could throw at each other. Failing to inspect the playground and remove those hazards would be negligent and would open you up to a test of liability if somebody was to get hurt. All right, so as I mentioned before, here are the elements of informed consent. So you're explaining the nature and the purpose of the program. You're informing the participants of any risks or dangers associated with participation, any possible discomfort that they may experience. And you're also explaining the expected benefits of participation. So if you have some sort of a fitness program, in addition to maybe experiencing some discomfort and the potential risks of participating in exercise, also they're going to get some benefits from it. So they may be stronger, they may be able to do more things, have more energy, and so on and so forth. Also going to inform participants of any alternative things that might exist that could accomplish the same thing. So your program may not be the only thing. So you don't want to communicate that that's the only choice for them. And I mentioned this before too, indicating that they're free to discontinue participation at any time, so they're not being coerced or manipulated to participate. And then, as I mentioned earlier, there's no such thing as a waiver of liability. If you are negligent, either through acts of omission or commission, you can be found liable in a court of law. So, risk management. There are consultants that will help you with risk management if you have enough money to pay them. But a lot of it's common sense. So you need to be aware of legal liabilities. You always need to utilize personnel that are certified and trained. So if you're going to do a bike education event, for example, if your instructors are certified instructors through the League of American Bicyclists, and can feel confident that they're going to, provide the best instruction. And if somebody was to challenge that, then you could say, well, all of our instructors are league certified instructors. Same thing with first aid, CPR. If you have individuals that are trained in that, then and they have up-to-date credentials, then that's good. Good evidence to bring forward in a case that might be brought in civil court. So obviously, always use good judgment, setting up programs, provide written guidelines for medical emergency procedures, and we'll look at emergency care plans here in a second. Always inform participants about risks and dangers of participation. Require participants to obtain medical clearance. So if you're working with adults and there's a chance that adults may have some kind of pre-existing condition, then you probably want them to have clearance from their physician in order to practice. Make sure that your staff don't practice medicine. Always, limit yourself to what you're trained to do. You may be able to administer basic first aid, CPR, that sort of thing, but certainly you don't want to get into doing things that are beyond your expertise. Leave that to physicians, leave that to family nurse practitioners, and so on. Provide a safe environment by following call codes and maintenance schedules for equipment and facilities, and then make sure that all of your staff have adequate liability insurance so it could protect them against potential lawsuits. Okay, so here are some things that an emergency care plan should include. And again, bad things can happen, some things that you absolutely can't foresee, but if you have a written emergency care plan, people are trained in this, and they follow those procedures. If something happens, then, regardless of, even if somebody dies as a result of participating in a program, you can show people that come in to look at what happened. You can show them, okay, here's our procedures. This is what we did. We followed these things to the letter, and you'll be as protected as you can be. So several pages of this. I'll let you take a look at the details here. So this has information about communication, access to a phone. On some of our bike rides that get out, well into the country, sometimes you don't get cell phone coverage out there. So you have to make sure that, there is some form of communication. We used two-way radios at our latest bike ride to make sure that we had adequate communication. Notifying people, significant others of program participants. What are you going to do about transportation if somebody becomes ill or gets injured? And then you have to have a way of documenting what happened, accident report, incident reports. If you're dealing with bodily fluids, you need to follow universal precautions and have the proper gear there so you're protecting both the participant and the caregiver. And again, I mentioned earlier that you have to follow the emergency care plan to the letter, and that you should have these approved by appropriate personnel. So Georgia College, for example, has people in student health. All of their procedures are approved by a university physician, and that physician is a community physician, but that person is responsible for looking over the procedures and signing off on those. And we also have our legal office as well to look at those things. So good idea to have physicians look at these things and sign off. Good idea to have legal people look at these things and sign off. And then, of course, always review and update your plan on a regular basis. Okay, so here's a little bit about moral and ethical concerns. As a program planner, you have an obligation to protect your participants by maximizing the benefits for their participation and by minimizing harm. So always keep that in mind. If you keep that in mind, you'll prevent 90% of the problems. So here's some words here. Beneficence means doing good. So that's what we want to do. Maleficence or malfeasance, I've heard it pronounced that way, is doing harm. Obviously, we don't want to do that. And then non-malfeasance or non-maleficence, tomato, is not causing harm. The Hippocratic Oath for physicians basically says that, if you don't do anything else, do no harm. You may not be able to cure the person or help the person, but at least don't make it worse. So a lot of what we do can be, we can protect ourselves by simply doing the right thing. So ask yourself, okay, what's right in this situation? What's wrong in this situation? And, do the right thing, and that can protect you from a lot of different things. All right, so here's, I think, the last slide that we're going to look at today, and it's the Code of Ethics for Health Education Professionals. So respect for all, respect for participants. Autonomy means, again, voluntary participation. You're not trying to coerce, persuade, manipulate people into participating. Informed consent, we already mentioned that, and all of the components of that. We mentioned these words: malfeasance, non-malfeasance, and beneficence. And the concepts of justice and fairness in all that we do, and then, of course, maintaining confidentiality and privacy of the information that we collect from participants that we need to have in order to, usually for evaluation purposes, but can also be for other things as well. All right, so that is all for this week, and we will see you in class on Thursday.